Hi, welcome to For Nursing Students by Nursing Students. My name is Monica, and today's tutorial is going to be about dosage calculations. A few things before we get started into the math. There are different styles to go about your dosage calculations. For me personally, I use dimensional analysis. It works for me. I like to see each step and be able to cross out my units that I'm no longer using. However, there are many different styles that are just as effective, and sometimes it's more confusing to learn a new style when you already have one down. So dimensional analysis will be in this lesson today. Another thing to remember is conversions. Now, you are going to have to deal with knowing how many micrograms in a gram, how many teaspoons in a tablespoon, how many milliliters in an ounce, how many pounds per kilogram, that sort of thing. So there is a level of memorization that you have to do in order to make sure that you know where to go with your dosage calculations. It's just a given. You got to memorize it. Another thing to remember is rounding. Different teachers will ask you to round in different ways. Different tests will also ask you to round in different ways. So pay attention to what it's saying, rounding to the nearest tenth, etc. Also, how do you do it on the floor that you're working on? Make sure to ask your preceptor, your clinical instructors, how they prefer that you do your rounding. And finally, and most importantly, is just because you're doing the calculation and you come up with an answer at the end, the really important part is to make sure that that dose that you have come up with is a safe dose. If you don't know the dosage for that particular medication, for that particular size patient, maybe it's a pediatric patient, you need to make sure to look that up in your drug guide. Also to make sure that IV fluids are compatible with other fluids that you might be piggybacking or doing IV pushes with. Always make sure that you're doing your 7 rights, the right dose, the right time, the right patient, etc., and that you're doing your 3 checks. These are very important for safe medication administration, as well as knowing the background pharmacokinetics of different routes of medications. So with that said, let's get into some math. So we're going to get into our dimensional analysis, but first I want to give you a little bit of a refresher before we get into the nursing medications. One way that I like to think about dimensional analysis is with this simple equation: how many seconds in a year? Let me show you. So, how many seconds in a year? If you start with the seconds here and you go by units slowly until you get to years, then this is what we end up with. 60 seconds over a minute. We know that there's 60 minutes in an hour, 24 hours in a day, and 365 days in 1 year. When we cross out each of these, we see that you cancel out the units. So that's why I really like dimensional analysis, because I can see if I've missed a step. So I have minutes crossed out, hours crossed out, days crossed off, and I'm left with seconds and years. So what you're going to do is, this is a multiplication, simple multiplication, 60 times 60 times 24 times 365 over 1 times 1 times 1 times 1. So when you do your calculations, what you come up with is there are 31,536 seconds in 1 hour. Okay, just a little refresher to get started. Let's get on to some actual dosage calculations. Ready for our first real equation? So what we have is metoprolol, 8 grams PO is ordered. Metoprolol is available as 17,000 milligram tablets. The question is, how many tablets should the nurse administer? So you really have to think about what the question is asking. Here it's asking, how many tablets should the nurse give? And it's telling you what is ordered, 8 grams, and what is available, 17,000 milligram tablets. So I always start with what we have, thinking about the unit that I want being on top here. So I know at the end I want tablets or tabs. Okay, so if I know that one tablet is 17,000 milligrams, I know the next thing that I want is to cancel out my milligrams. So I'm going to move on to saying that there are 1,000 milligrams in 1 gram. And the reason why I'm moving this direction is because I know that ordered is the gram, so I need to convert to this unit. Next, I can say, opposite of this, up here, that 8 grams are ordered. So, if we go along the lines of crossing out our units, we have milligrams to milligrams, grams to grams. I'm left with knowing that we're going to find out how many tablets. So if we go 1 times 1,000 times 8, which is 8,000, and we divide that by 17,000 times 1, we come out with 0.5 tablets. I always like to square my answer so that I know that that's it and that's the end of it. On to our next question. So this next question has to do with IVs and flow rates. So the question is, ordered is 11.6 milligrams dopamine in 491 milliliters of D5W to be infused at a rate of 14,024 micrograms per hour. Calculate the flow rate in milliliters per hour. So, once again, what we're going to start with is what we want to end with. So we know that we want to know how many milliliters per hour. So we're going to start with the milliliter portion. Up here, we know that we have 491 milliliters of D5W. And then we know that there's 11.6 milligrams in that. Next, we need to go to milligrams, and we know that we need to convert to the unit of micrograms here. So if we think 1 milligram is equal to 1,000 micrograms. So this in itself is essentially 1 over 1. So now we can move to the micrograms up here. And this is where we put in our microgram rate, what is ordered, and this is going to go per hour, micrograms per hour. So I cross off my units, making sure that I've done the math correctly, things are in the right places, micrograms to micrograms. I'm left with milliliters over hours. So if we do the math here, we have 491 times 1 times 14,024 micrograms divided by 11.6 divided by 1,000. What we come up with is 593.6. And that's what you're going to put into your IV pump, 593.6 milliliters per hour. So for our last and final question, we have this one here, which I think is very important, good example of what goes down when you're at your clinicals or when you're working. So a lot of times you'll have, if you're working in with the pediatric population, you'll have to do a lot of dosage calculations to make sure that it's within safe range for that child. Usually goes by weight. Another thing is that you often have small vials, 1 milliliter or 2 milliliter vials that have a certain amount of milligrams of a medication in it. And so you'll be doing that type of calculation a lot. So this example has both of those. So the question is, Solumedrol 1.5 milligrams per kilogram is ordered for an 8-pound child. Solumedrol is available as 75 milligrams per 2 milliliters. So the question is, how much are you going to draw up? How many milliliters? So I know that I'm going to be ending in milliliters over here, and I'm going to start with what I have with milliliters on top. So I know that I have 2 milliliters, and that 2 milliliters is equal to 75 milligrams. Heading up over onto the next one, we're using our milligrams here. I know that we're going to give 1.5 milligrams per kilogram. That's why I kind of like dimensional analysis too, because if you're lost of what the next step is to do, you just look down here and plug in your next unit here, and that will help you guide along the way. If things aren't matching up, then that's not working. You need to start over. So 1.5 milligrams per kilogram. I know I need to go back up to my kilograms. I know that 1 kilogram equals 2.2 pounds, which we need to add in how big this child is. 8-pound child. Okay, so doing the math for this one, or before we do the math, we see that we have all of the correct units here. So, milligrams, milligrams, kilograms, kilograms, pounds, pounds, left with milliliters for this child. So we have 2 times 1.5 times 1 times 8. We're going to divide that by 75 divided by 2.2, and what we come up with is 0.145 yada yada yada. So I'm going to round this up to 0.15 mLs. Sorry about the writing there. That's 0.15 milliliters. So what you're going to do with this after you've done this equation is also go into the pediatric dosage book and make sure that this dose is within the range for a child of this size. So that's your last dosage calculation there. I hope that this helped or was a good reference to come back to as you review your dosage calculations. I know the more that I practice, the better I am. And when I stick with the style that works for me, then that's when I'm the most successful. Always check your dosages with your preceptor. Always check your dosages with another nurse if it's that category drug. So thanks for learning with us today. This is just a style of how we might learn ourselves and sharing it with you. Thanks for watching.